So the only thing we can do is reprogram our nervous system's response to it.
Absolutely. And let ourselves move through that trauma response in like a safe and trusting way. So the trauma response to be finished, you need to have that trauma response. You need like trembling or yawning, crying, deep breathing, like the animalistic way. Like we see this in animals, right? Like animals will shake after they're scared. They shake. And this is them releasing that trauma response. What I'm going through is not a big deal. Where it is, like your body is going to hold that unless you give it space and time to move through it and process it physically. So, yeah.
Yeah. Yeah. It's powerful. It's very powerful. So tell me, like, I saw you specifically work with nurses, which I know we mentioned a little bit before this, but nurses is a hard population to work with because sometimes we're not the first to jump to help ourselves.
We're usually not the first to jump to help ourselves. But I feel like there's a shift happening. I feel like there's a shift in nurses realizing what we do go through. And again, it's a cultural perception within the nursing culture that what we go through is normal, that everything we deal with on a daily basis is normal. You know, like hearing call bells for 12 hours is normal. Dealing with a patient code and then packing that up and moving to the next room is normal. Like we just have a totally messed up way of thinking of what normal is. So because it's not, you know, and sometimes I think nurses will realize that if they're, you know, talking maybe to the partner about something and then they, you know, kind of look at you, it's like, what? That's not normal. That's not a normal experience. And we go through that every day. You know, we go to work and we go through that, and we're seeing a lot of nurses acknowledge that they're burnt out, you know, having that pre-shift anxiety, post-shift anxiety, but maybe not quite knowing what to do with it.
Mhm.
um, so that's why I really wanted to focus in on nurses.